So let's meet some of our 2014 winners and share their stories. Here's what they had to say.
I'm Ellie Hobart. I'm the Deputy Director for Engagement and OD at the Tower Hamlets Clinical Commissioning Group. We won Best CCG of the Year at the HSJ Awards in 2014, and the best thing about winning was the greater sense of team working that we got from pulling together to get the award. And I must just say it is comic relief today, so my daughter, my 7-year-old daughter Sophia, has done my makeup, hence I might look a bit strange.
Hi, I'm Helen Thomas and I work for NHS Wales Shared Services Partnership. I'm the ESR, which is the Electronic Staff Record Programme Manager for NHS Wales, and we won the category for improving efficiencies through the use of technology.
Hi, I'm Eugene Levan. I'm the QUIP Programme Director for Bridgewater Community Healthcare Foundation Trust in Wigan. And we won the category for long-term conditions. And the best thing about winning was the recognition for the team across the whole of Wigan Health and Social Care and the contribution they've made to improving patients' care.
I'm Phil Walters. I'm from South West Yorkshire Partnership Foundation Trust, and I lead on our Creative Minds programme, and we won the category of compassionate patient care. The best thing about winning was recognition for all the hard work that we put into developing the programme and all the people that have been involved. It felt like we were recognised for that hard work.
Like everybody in the NHS, you are very, very busy people. Why did you think it was important to find the time to enter the HSJ Awards? Ellie?
Well, yeah, I mean, it is a time-consuming process to some degree, though still doable. I think we wanted to make that time because we felt that as a CCG we'd been in place for over about 18 months, that we'd achieved a significant amount in that time and also previously in Tower Hamlets, and that, you know, to get that external recognition of that work is a good thing, but it also enabled us to kind of really pull together as a team. And that was amazing, really. Everyone got involved, everyone really wanted to support and input into that process, so it was really good in that sense as well, and that's why it was worth it.
Is that similar for you, Helen?
Absolutely, yes. I mean, we believed fully in this project and the fact that we could improve patient care by reducing efficiencies, but to have it validated by a panel of experts and to win the award just verified that we were doing the right things, even though it was time-consuming to enter. It was the right thing to do, have that validation, and again, as Ellie said, it's that team reward as well and that recognition.
Yeah, I mean, I think we had a good story to tell and we wanted to tell it, was our take, and we found the process actually quite straightforward. We've entered in previous years, and I think just telling the story about, you know, this is our journey, this is what's happened in Wigan for us, this is the impact we believe we made, was quite easy to do. We sat down one afternoon and we just wrote it, and it just kind of flowed easily for us.
I think for us it's slightly different, I suppose. It was something new that we were doing, and it was a non-medical approach, and I think an award vindicates that approach, really. We deliver creative projects to people who use our services, predominantly mental health, and I think you need something like this to raise it above the kind of to get some attention and for practitioners to take it more seriously, because it can be seen as soft and fluffy, and actually we've got some great results and we wanted to tell that story, really, so that's the reason.
So, of course, all four of you are winners. You did fantastically well to win, in every case, such hotly contested categories. I hope and trust that on the night you enjoyed yourself, as you probably should. I'm interested in what reactions you got when you arrived back home. What did people say to you when you came back to base? Phil?
It was quite strange, really, because everybody knew about it. Our communications team had communicated it within the organisation, so everybody knew, and everybody was... I suppose it did what we wanted it to do. It did raise the profile of the project, both internally, but also when you're out and about and talking to external partners, they were aware of it, and we got a lot of kind of feedback. And it just puts you on a positive step, really, I would say. That's probably the most it's done so far. It's put us in a positive position.
Yeah, well, Twitter was buzzing literally as the kind of announcements came in, so that was one of the great things, I guess. And we were getting lots of congratulations from across health and social care in Wigan, and ours is a partnership bid, so that was really pleasing. And I think there was a great whoop of delight as I came into the office with the awards. So it was fantastic, really. So it really kind of permeated the whole organisation very quickly.
Well, they say good news travels fast, but I didn't expect our Chief Executive to know so quickly what we win, and to hear so fast how we did it. And also the Chief Executive of NHS Wales opened one of the conferences the next day with the celebration of our award, so it really was held in high esteem, absolutely.
Yep, congratulatory. The team were ecstatic. I actually was at a meeting the following morning with another London CCG that had actually got to the kind of final, and they were kind of wanting to know how we'd done it and kind of learn from our experience. But yeah, very congratulatory, and kind of opened it up to people wanting to come and visit. So we've had lots of phone calls and emails asking if they can come and visit Tower Hamlets. So
Ellie, that's perfect, because that's the next question that that I wanted to ask. One of the reasons that we do so we run the HSJ Awards because we want to recognise and we want to celebrate the very best practice in the NHS, but we also want to help spread it. So I'm very interested to see to hear who you heard from, who came and talked to you. So Ellie, you've already mentioned that. Who was coming to see you? What kind of questions were they asking you?
So other CCGs, kind of trying to learn. They'd picked up on areas of our submission around engagement and around integrated care, so they wanted to kind of follow that up and find more out about those kind of areas that we're leading on. We've had requests from Public Health England, from the Treasury, so quite a few different requests have come in since. Always good, though sometimes dangerous, to attract the interest of the Treasury. Phil, you were making the point that you were doing something slightly different, which you wanted to raise the profile. Did it work? Did people come and talk to you about it?
Yeah, we're getting a lot of contact from different organisations that have heard about us and want to come and find out more. We are looking to do some kind of conference, kind of festival kind of idea to share some of that good practice and bring other people together. Because I think when you are doing something that's new and different, it can be a lonely place, really. So getting that attention, people coming, because even though you've won an award, you can learn from other people. And I think that having those conversations that have only just started, really, I think it's the beginning of those conversations. It's great to talk to people and share all that good practice and information, really.
And Helen, did you get a lot of people contact you from across the UK?
We have, yes, and more importantly as well, within Wales, the Welsh Government has certainly recognised this project and positively supporting and endorsing it. The other thing that we've been asked to do as a result of winning this is to undertake a seminar in the HETT, the Health Efficiencies Through Technology Exposition, which is in Olympia in London in September. So we'll be holding a seminar there to share the good practice across the rest of England.
What about Eugene?
Yes, well, indeed, we've had lots of people contact us actually before we won the award, and actually afterwards as well. So it's obviously heightened kind of interest, and a lot of places actually need to do and are doing what we're doing. So I think the key difference for us is around scale and pace in terms of our project around long-term conditions. So it's certainly helped describe what we've done to clinicians who may be thinking, it's in a too difficult to do box, that you can actually scale this up, you can make the change quite quickly, and so we've got lots of half-day events planned where other areas are coming to us to learn about what we're doing.
Okay, what advice would you give to people who are considering entering the HSJ Awards this year? Helen?
I would certainly encourage them to enter the award because it certainly reinforces what you do as good practice. It certainly gets you to reflect on what you're doing and why, and what impact has that made, and how is it, in our case, how has efficiencies improved patient care. So it validates external validation of the project and what you're doing.
And was there any advice you would give them in terms of how they might go about writing the most powerful entry?
I think it's looking at the outcomes and making sure that it's evidence-based.
Ellie, what would you say?
In terms of the application or...
Yes, you know, what would you say to people who are saying, I've got this project, I think it's good stuff, shall I enter it? I'm not sure. And if I do enter, how do I maximise my chances? What advice would you give to that person?
I'd definitely say enter. I think the process in itself is of value. So for us anyway as a CCG, because it really meant we had to pull together, so that had a value. And having the time to reflect and kind of consider what you're doing, because you're so busy all the time, just having that space to consider and actually appreciate what you've done, and as you said, identify your outcomes and so on. So definitely do it. Do it well, yeah, focus on the outcomes, try and be succinct as possible. People, you know, are marking anything, you're going to see a whole raft of information, so you really need to have powerful messages in a really succinct way that really speak to people quickly.
Yeah, I'd agree with all of that. You know, the first kind of couple of paragraphs are key, aren't they? You've got to grab their attention, and that was our approach, really. We want to be able to say to people, you know, this is Wigan, this is what we've done, and this is what we're proud of. I think if you can't sell it in half a page, you can't tell it. Yes,
similar kind of things, really. I think the information that we provided for HSJ, we've put that into a bank now where we draw on that information for other things. So if we're looking for funding and we want to promote the project, you've got that bank of information to draw on. We were very conscious about image. We developed a strong image. This is a T-shirt that promotes the project. And we've got magazines, we use Twitter and Facebook, and I think it gives you more confidence, and articulating your message is quite important too. And in terms of people who use our services, they're drawn towards that as well then. If you get the message right, I think people will respond and want to be involved and benefit from the project.
Thanks very much.